Welcome back to Mayo Clinic Radio. I'm Pratish Tosh.
And I'm Tracy McRae.
According to the Centers for Disease Control and Prevention, more than 42,000 people in the United States die from suicide annually, making suicide the 10th leading cause of death overall.
The facts and figures about suicide are one thing, but the role that impulsivity plays in a completed suicide is often not appreciated. Here to discuss these statistics is Mayo Clinic Psychiatrist Dr. Michael Bostwick. Welcome back to the program, Dr. Bostwick. It's good to have you here.
Thanks.
So impulsivity, I think, is probably not the first thing that comes to people's mind when they hear a fact like the number of people who die every year. So first of all, do you think is that figure sound about right? 42,000 people die every year?
Oh, absolutely.
Wow.
And in fact, the rate, which is 12 to 14 per 100,000 per year, has really not varied a lot outside of a range of 10 or 20 percentage points for decades, if not a century.
So the idea that people have that suicide is an increasing problem in the United States, is that just that we're seeing more coverage of it, or people are talking about it more, or why is that?
Probably both. I mean, there are statistics saying that since 2000 the rate is up 27%, but we're talking about a rare phenomenon that's a little less rare. That does not mean that when it occurs it isn't absolutely devastating. And unlike most medical conditions, people are at risk for suicide over the course of their entire lifetime. That makes it different from certain cancers, for example, where you're not at risk till you're 55 or 60. Suicide becomes the 10th leading cause of death in the U.S. by attrition. You just add up all those years and years and years that people are at risk.
Dr. Bostwick, you have done a lot of research, and including research in suicide. And what are some of the things that you have uncovered that maybe was not previously known, or things that you've figured out through your own research that may not be common knowledge?
Well, now almost 20 years ago, we did a paper that showed sort of a hierarchy of risk that won't be surprising, but had never been shown in a meta-analysis. People who have been hospitalized with suicidality have about a 1 in 11 risk of dying over their lifetime of suicide. People who've been hospitalized for mental health reasons have about a 4% risk, so 1 in 25. People who've seen psychiatrists as outpatients also have a somewhat elevated risk. But the most recent research that we were interested in was looking to see if a statistic, suicide is much elevated after a suicide attempt. Completed suicide is much more likely after a suicide attempt, whether we were studying the right people. So we looked at almost 25 years of medical records from Olmsted County here in Rochester for people who made their first medically known attempt during that 25-year period. We followed these patients, 1,500 of them, for anywhere from 3 to 27 years. And what we found was that about 60%, almost 2/3 of the people who made a suicide attempt died on the first attempt. What that means is their first stop was not the emergency room or the hospital. Their first stop was the coroner's slab. And why that's relevant is that everything we know about suicide after suicide attempt is based on populations of people who've already made an attempt and who are in the hospital, who have come to the emergency room, so-called convenience samples because they're not complete samples. So what this really suggests is that we have to do what we can to have people not make the attempt at all.
You had mentioned that you'd studied impulsivity and the role that plays in this. And can you elaborate a little bit about what that means?
Well, let's link what we learned from another aspect of the study to the question about impulsivity. The odds ratio for dying by gunshot was 140 times more than any other method, meaning that if a person used a gun, they were exceedingly likely to actually succeed. A very high proportion of the patients, the individuals in our study, got it right, as it were, by using a gun on that first attempt. And what we know from people who have survived bridge jumping, hanging, gunshot even, is that they very often regret what they did, that it was an impulsive action. They can't believe what happened, and they're very grateful to be alive. So it makes me wonder, with those many people who are dead of gunshot, whether they might have gotten better. Again, a good way to think of suicide is that that it occurs at a crisis in a person's life, driven by, among other things that have happened to them, depression, things that we can manage. But if they get to the point of actually wanting to self-harm, and there are a very high proportion of Americans who have those thoughts, then impulsive means, or means that will work, that are available to be used, can't be regretted if they succeed.
Wow. And is there things that can be done, either by medical professionals or family members? What are the things that, can we intervene on this?
Well, based on the study, the obvious thing is gun control. And so that we don't cause everybody who loves guns to descend upon us and yell at us, the issue is keeping them locked up, keeping them away from people who might use them impulsively.
So it doesn't mean turn your gun in, never to see it again. But I remember another time during Suicide Prevention Day, you had said it can be if there is a temporary situation where the person is in crisis, then by all means, temporarily remove the gun from the home.
And suicide is described by some as a permanent solution to a temporary problem. Remove it from the home, lock it up, be aware that you have things people can use impulsively around your house. Guns are the most obvious one and the most lethal one. That's what our study shows. And there are lots of ways to find out what people look like who are at higher risk. They look depressed. They're talking about being dead. They're giving things away. They're acting as if there is no future. So these are all things where we know we should be seeking help for these people to treat what is often a depression. One of the things I think is really interesting, I don't personally believe, so we'll probably make all the suicide researchers mad at me, that you can actually prevent suicide for a person who really, really intends to do it. But many of the things that drive suicidal states are highly treatable. Depression, substance abuse. And if we deal with those things, I would think and believe that over time suicide rates would drop.
And dealing with mental health, you said depression is one of the key pieces to that situation.
Absolutely.
Well, Dr. Michael Bostwick, Mayo Clinic psychiatrist, thank you for joining us and speaking with us about the role that impulsivity plays in this ongoing problem in this country. Thank you.
You're welcome.